Hi, it's Miss B from Humsbums here, and today we are going to start our AQA GCSE History revision. We're going to start with the health and the people topic and focus on the Middle Ages, 1250 to 1500, where medicine was shaped by religion, tradition, and only a little bit of progress. We're going to do this in 3 minutes, so get your pens and paper ready to write notes. So key ideas about disease. The 4 humours are really important in this period. They have to be in balance for you to be healthy. Another issue is miasma, bad air, so bad smells. This was blamed for things like the plague and other causes of disease. We've then got religion, probably the biggest takeaway you need to know. Disease, it was a punishment from God. You were cared for, but you couldn't be cured unless God wanted you to be. You've then got superstition and astrology. This is the alignment of the planets. This was used to diagnose and also blame for things like the Black Death. So this period is one of continuity and regression, really. The ancient ideas of Galen and Hippocrates dominated, and those are 2 names you need to know. So the role of the church, incredibly important. The church controlled education. Galen was seen as the official truth. His word was the only word to go by. So monasteries were the centres of care, but they banned dissection in much of Europe, which slowed down new ideas as Galen was wrong in his dissection. The role of the church, however, preserved ancient texts, and they provided hospitals, but they focused on care, not cure. Islamic medicine was much more advanced in Europe in this period. Avicenna wrote the Canon of Medicine, which was an encyclopedia which was used in Europe until the 1700s. Other people in Islamic medicine to know are Raz. He distinguished measles from smallpox. Abu Qasis, father of surgery, described surgical instruments and techniques. Huge influence on later European medicine. Remember that Islamic medicine is far more advanced than Western medicine at this time. Moving on to surgery, we've got barber surgeons, bloodletting, amputations, trepanning, and cauterization. So one person you really need to know is John of Ardern. He wrote Practica, which was a surgical manual with diagrams, and he was a specialist in treating abscesses and fistulas. He tried to professionalize surgery and saw it as a skilled craft and not a barber's hobby. Public health and the Black Death, so towns and cities, they're filthy. There are attempts improvement, fines for dumping waste, but there wasn't much enforcement. So the Black Death believed causes were God's punishment, bad air, Jews poisoning wells, and responses were flagellants, whipping themselves, religious processions, herbal remedies, and a third of Europe was killed. So we're now going to have a little bit of reflection time. So these are the questions you should now be able to answer to know this topic. Thanks for watching. Make sure you subscribe, and we'll see you next time.